Thank you, Madam Chairman, and I thank you for holding this hearing today. Over the last year, we put in place measures to slow the spread of coronavirus. This new virus quickly escalated from an outbreak in China to a pandemic that has challenged countries around the world, including the United States. While these measures were put in place to ensure our health system could weather the storm, these measures in the pandemic have in many ways asked so much of Americans. Families with critically ill and dying loved ones have not been able to visit their parents, grandparents, and siblings, instead saying goodbye over video. This has compounded the grief for so many and taken a tremendous toll on healthcare professionals. Sacrificing simple acts like hugging our family members, neighbors, and feeling a sense of purpose when we walk into the office every day have consequences on our mental health. A year of sitting 6 feet apart, canceling weddings, holidays, adjusting to remote school has had an effect on the well-being of every American. We must continue to examine these effects as part of our review of the COVID response. Our current Surgeon General has written a lot about the effects of loneliness. He's explained that this lack of human connection can lead to depression, anxiety, and chronic conditions like heart and dementia. It's no surprise to me that after a year of being apart, we're seeing the heartbreaking effects of separation and sacrifice. Prior to the pandemic, experts estimated that 1 in 4 adults in the United States had a mental health disorder. And we're also in the midst of responding to an opioid crisis. The need to respond to these challenges continued during COVID-19. Reaching people and providing care required innovative approaches from doctors, nurses, and other healthcare providers all around the country. I look forward to hearing about those solutions from our witnesses today. We're a resilient country. I believe that the most important action we can take to help people is to reopen as much of the country as quickly and safely as possible. Bring back hope to the American people. Let neighbors celebrate birthdays and milestones, and let students see and interact with their peers. My state of North Carolina has taken an important step in this process, announcing plans to lift COVID restrictions on June 1 if our metrics continue to show the progress against the virus that it has to date. Vaccinations are a key metric. We've got to look at the next few weeks and months down the road to address the next phase of response, getting more shots in arms. The return of the Johnson & Johnson vaccine is an important part, and I'm glad that the CDC and FDA finally reaffirmed the safety efficacy of that shot. But I'm worried about the ham-handed way they handled this has led to even more vaccine hesitancy than before. Americans should know that the benefits of using the vaccine far outweigh the potential risk. Now, with 37% of adults fully vaccinated, we're seeing the demand slow. So painting a picture of benefits of all 3 vaccines, Pfizer, Moderna, and Johnson & Johnson, will be important to driving down our infection rate and improving our chances of a recovery. Getting back to work is a big part of that picture. And we can't do that until children are in daycare or in school. The reopening of our restaurants, our ballparks, and small business mean more opportunities for Americans to return to activities they love, but it also means more jobs and more opportunities to restore their livelihoods. We invited the witnesses here today because they've seen the mental health effects of pandemic and the response in their communities firsthand, but also because they've raised their hands with local solutions. I look forward to hearing about those local solutions today and how they can help to accelerate our country's broader recovery from COVID. Our message and the message of this administration should be that we're willing to have teachers and students back in classrooms safely this fall, that Main Street is open, that Thanksgiving plans are on the books, and that this summer you can even attend a ball game with certain precautions. Even if things look a little different, life can almost become normal. I thank the chair.